I'm going to talk about exposure therapy and why this is so powerful for anxiety disorders. I've been using exposure therapy for a really long time with my clients to help a whole range of disorders such as phobias, health anxiety, OCD, social anxiety, panic disorder, and other anxiety disorders. And the reason it is so powerful is when someone is anxious, they are terrified and they don't want to be experiencing those uncomfortable feelings. So quite naturally, they want to avoid. But in order to help people overcome many anxiety disorders, I encourage them to go into the situation and sit with their fears. Usually people don't want to do this, and this is why I like to work quite closely with people, either being there in the situation or being on the other end of a video call, convincing them to go into the situation and stay there for long enough for their anxiety to subside. So an example of this is a client that I was working with in London, and he was terrified of enclosed spaces for fear of having a panic attack. And I took him to what's known as the Emirates carts, which is these carts in Greenwich in London, and they go over the water and you just tap with your contactless card to get on. Door closes and then you go over the river. But once you're in, and that's a 10-minute journey. You cannot get out. It's a very enclosed space, quite small, only fits a couple of people. So this client was absolutely terrified. He really wanted to overcome his fear, and he had signed up for an intense package of training with me. So we'd scheduled 6 hours where we were going to do some really challenging things. And this was one of the activities. And we had got to the entrance of the carts, and it's then my job to convince him to go on. He was paying a lot of money to see me, so I knew I had to get him to go on. I knew that he wanted to do it, even though his emotions were saying no. So when we're at the entrance, he's saying, no, I've changed my mind. I don't want to go on. And I just kind of guided him. I sort of grabbed his wrist and I just kind of said, we're doing it. Maybe that sounds a little bit aggressive, but I knew that he would be okay. And I had lots of strategies to show him once we were in there. So I knew he'd thank me for it later, and we had good rapport, so it wasn't like I was just forcing this person I didn't know to do something that he was terrified of. We'd had lots of consultations beforehand, before this big day of doing lots of exposure, so he had signed up for this and it was fine. But it might sound like a bit of an aggressive move to force someone into a situation when they're screaming saying no, but I had his consent, so I pushed him into the cart. It closed and he's terrified. He's still saying no. He actually did have a panic attack, which interestingly enough was one of his worst fears. And you might ask, why would I want someone to experience their worst fear? Well, the reason I wanted him to have a panic attack is because when people are scared of having panic attacks, they always try to avoid that. And they think that a panic attack is going to be the worst possible thing that could happen. But actually with this client, he was having the panic attack, and then I just got him to look out over the water and just tell me some things he was noticing. And straight away his focus went away from the panic attack. His anxiety came right down, and he started to enjoy the scenery and started to say things like, I'm okay now. I feel much better. And then he started to smile and laugh, and he couldn't believe he was there coping with the situation. So quite quickly, in a matter of minutes, he went from having a panic attack and not coping very well to actually just changing his focus of direction, realizing he could sit with the high level of anxiety he was experiencing, and it wasn't causing him to faint or collapse or anything awful to happen to him, which is often what people predict when they think they're going to have a panic attack or when they have fear of having panic attacks. And then we got to the end of the journey and he gave me a big hug and he said, thank you so much for making me go on to that thing. I've been avoiding that for 10 years. I have just been terrified of enclosed spaces. And there was lots of things he couldn't do. He couldn't go up in lifts, anywhere enclosed, even being in his car was quite terrifying. Any place where he felt he couldn't escape easily was a massive trigger for him. And that was one example of when intense exposure therapy, where you just really go for it. And in my job as a therapist, I really try and get people to just stop avoiding and go straight to their worst fear. And this was one of my clients' worst fears. And afterwards, his beliefs had changed. He realized that actually he didn't need to avoid this thing anymore, and that the anxiety he thought he was going to experience was not actually going to be completely unmanageable, that he could sit through the high levels of distress. And while it wasn't comfortable, it wasn't something that he completely couldn't tolerate. And then he did it a few more times, and then it was like nothing. It was like watching a horror movie 100 times. Yes, the first time was awful, but with time, you just get really used to the experience. In fact, you kind of get bored. You just can't have that same reaction over and over when you stop avoiding things. And this is why exposure therapy is so important to many different anxiety disorders and is really key in the treatment of overcoming anxiety disorders. So if you've liked this video, please subscribe to my channel. And also, if you do want further advice on any type of anxiety disorder, you can contact myself at the clinic.